If you're pregnant or postpartum and wondering what are different reasons that I need to call my provider or head to the ER, this is the video you need to watch. I'm Roxanne. I'm a labor and delivery nurse and student midwife, and one of the most common questions that we get during pregnancy and postpartum is how do I know when to seek help and reach out to my provider during either of those phases of life? So we'll first go over pregnancy and then postpartum. During pregnancy, there are a bunch of different reasons to rush to the ER potentially or rush to labor and delivery, but more so the reasons to seek help is you're in labor and you're after 37 weeks, or you're potentially having contractions and you're before 37 weeks. Definitely, obviously a common reason to go. You think your water broke, and this could be before or after 37 weeks. Definitely a reason to head in. But bleeding is another reason that people don't realize that you can seek out either care in your clinic or head to your labor and delivery anytime you see bleeding. It's not normal to have blood, whether it's passing clots or just having a little bit of dark brown bleeding. Anytime you're having some sort of bleeding, we would want to investigate why. It could be you're having some sort of vaginal infection potentially, and this is a thing that we would want to treat during pregnancy. It could be that maybe you have placenta previa and this is causing some issues, or there's some sort of blood vessels down there that are bleeding that we would need to address. It could be a common occurrence where there's some sort of manipulation of the cervix, whether through intercourse or maybe you had a vaginal exam, and that would just rule it out that everything's fine. But it's always a good reason to come in if you're having any sort of bleeding going on during pregnancy, whether this is before pregnancy or even during labor. During labor, if it is that more mucousy type of blood, that could be normal because that is your cervix dilating. But if it's ever a watery type of blood, that is alarming to us and we would want to investigate why. Other reasons, and this is my biggest reason to ever seek care, is decreased fetal movement. After 28 weeks, we should be doing our fetal kick counts, and this could be either done with measuring, sitting down for 2 hours a day, just trying to get our 10 kicks. Or we can do monitoring baby's intuitive movement patterns throughout the day. So this is just you monitoring when is baby most active throughout the day, and then is there a change in baby's normal movement patterns throughout the day. There is a myth that as you get closer to term, baby moves less because there's less room for baby to move, and it's very normal for baby to move less. It's not normal. Baby should not move less just because you're term. Baby should be continuing to move even though you're at term. The movements, though, may feel different. So baby may not be able to move these big, huge rolls or big, huge kicks as much as they were before, but you should still feel the same number of movements. It may just feel differently. If you have decreased fetal movement, though, go into the hospital to be assessed. Shortness of breath during pregnancy is another reason that is common during pregnancy, but if it's sudden and you're having trouble breathing with that shortness of breath, during pregnancy we are hypercoagulable. So we're more likely to develop clots during pregnancy as a very good homeostasis method to keep us safe during pregnancy and keep our babies safe during pregnancy. But it puts us at an increased risk of developing clots, especially if we're not moving as much during pregnancy. So one of the things that we're always going to be on the lookout for is what's called a pulmonary embolism, or even just DVTs, deep vein clots. And so if you start having any kind of tender spots that's one-sided, tender to the touch, warm to the touch spots on our lower legs, or sudden shortness of breath, these would be signs to definitely seek some care to be assessed either emergently with that shortness of breath or potentially going to your provider to be assessed for those deep vein clots. Another more medical reason to be seeking care is if you have either a history of high blood pressure or you start developing these symptoms of high blood pressure. Seek care immediately. This is early signs of what we would call preeclampsia, or it could be later signs of what we would call preeclampsia. That could then progress to eclampsia. So eclampsia are full-blown seizures that develop during pregnancy due to a high blood pressure, and then preeclampsia is bodily functions and organs within our body are now becoming affected by our high blood pressure. Sometimes you may not even have the high blood pressure. It might just all of a sudden overnight blood pressure skyrockets, as well as all of these other symptoms. So being on the lookout for a headache that doesn't resolve with Tylenol or any sort of pain medication, sudden blurry vision. If you have glasses or you wear contacts and that blurry vision is normal for you, but all of a sudden now it might be caving, it's blackness caving in on our sides, spots in our vision, and then a change within our blurry vision that comes and goes, that's also a sign of preeclampsia. It could be right upper quadrant pain. So our liver can be affected by our high blood pressure. And so if we're starting to feel pain at our liver, that is a sign that we need to be seeking care, or even just like epigastric pain right here, which is like the center of our chest. And this is again, like our liver expands like this whole span here. So you can start to feel pain here to here. Different than your baby just kicking you there. It's more like a constant ache. And then another thing is sudden weight gain. So it used to be swelling just in general as a sign that we would want to do a workup for preeclampsia. But now it's more sudden weight gain, and weight gain, like the edema is the cause, like the swelling is the cause of the weight gain. And sometimes if you even like touch the legs that are swollen and it leaves an indentation, that is what we would call pitting edema, and definitely something we would want to look into of why you're having this, and potentially it is a high blood pressure, and we would need to be like treating you, either moving towards delivery or potentially like blood pressure medication or whatever, depending on your stage of pregnancy. Definitely reasons to go in. So just to recap, there are probably other reasons to go in, and anytime you're concerned, you can go in and see your provider or go to triage. But common reasons are, again, contractions or pain. Any type of pain or contractions, definitely you can reach out to your provider. Any rupturing of fluids, so like leaking fluid, either preterm, so before 37 weeks or even after 37 weeks. If you're having any sort of bleeding, decreased fetal movement, always go in and be assessed. That's my biggest thing. Don't be afraid that you're gonna waste our time. You're never gonna waste our time for decreased fetal movement. Go in and be assessed. We would hate for you to feel like you're gonna waste your time and not come, and then things actually need to be addressed. Any shortness of breath or like redness, hard spots, warm spots on your legs as a sign that there is a clot within our lower legs, definitely come in and be seen. And then the last one, any signs of preeclampsia. So headache that doesn't resolve with any sort of Tylenol or pain medication, blurry vision, spots in your vision, right upper quadrant pain on our abdomen, or even center like epigastric pain on our abdomen, and sudden swelling and like really, really bad swelling that like comes on quickly and doesn't really resolve. All reasons to come in and be assessed during pregnancy. Now, after you have a baby, what are reasons to reach out after we have our baby? So there is an acronym created by AWON, which is like the governing body of OB nurses, that I love, and it's called post-birth. It's really easy to remember, post and then birth, because these are reasons to seek help post-birth. So post are all reasons that are you need to go to the ER, emergent type of reasons. And then birth are reasons that you should call your provider, but if you can't get a hold of them, then go to the ER. Post is P stands for pain in our chest. So this could be a sign, again, that like a clot has dislodged and traveled to our lungs. So now we're having some chest pain. Seek help for chest pain. Obstructed breathing is O. So shortness of breath, obstructed breathing. These are signs, again, of that pulmonary embolism, because our hypercoagulable state during pregnancy does not resolve immediately. It can take a few weeks postpartum for it to resolve. So we're still at risk of those DVTs and clots forming and dislodging and traveling to our lungs. So shortness of breath or pain in our chest, definitely reasons to be seen emergently. Any seizures. So seizures are that eclamptic seizure. So if you had preeclampsia during pregnancy and now it just has progressed to full-blown eclampsia, or it can develop during postpartum and you go quickly and it progresses quickly to that seizure, please call 911 if you have a seizure. And then the last one is T, so thoughts of harming yourself or others. It is now determined by the CDC that mental health is one of the top reasons of maternal mortality in America. And it is a very, very huge thing that we need to address in the postpartum. Perinatal mood disorders are huge, and they're very commonly underdiagnosed. So postpartum mood disorders, again, common, they happen. But postpartum psychosis is those ones that are the severe ones that need to be treated to potentially save your life, save the lives of your loved ones, or even your baby. So you see those really sad stories of like a mom who like killed herself or killed her baby. These are commonly caused due to postpartum psychosis. So mental health, please, if you feel yourself as having these thoughts, or you see this in your loved ones, seek help immediately. So post, again, pain in your chest, obstructed breathing, seizures, thoughts of harming yourself or others. Go to the ER immediately. Now, birth. Birth, B, bleeding. Postpartum bleeding, very common. It lasts for 4 to 6 weeks, but that heavy bright red bleeding usually should last about that first week of postpartum. If we're saturating a pad, a full menstrual pad in 1 to 2 hours, or passing really large clots and then continuing to bleed afterwards, go in and be seen. Call your provider or go to the ER because that is too much bleeding, and this is a sign that you're likely having what's called a postpartum hemorrhage, which is another top reason of maternal mortality in America. Go in and be seen if you're having a lot of bleeding. If you're also maybe not saturating that pad, but you're saturating a large amount of that pad constantly throughout the day, this is what we would call like a slow trickle of bleeding, where it just seems like you're constantly just oozing blood. Over time, this can cause you to like have lost a large amount of volume, and our body like can't keep up with losing that amount of blood. We can't keep creating enough. So you might start having symptoms like lightheaded, dizziness, like shortness of breath, and like feeling like you get up and you either almost faint or actually do faint. Go in and be seen because you may benefit from a blood transfusion and also be assessed for why you're still bleeding that much. Next is your incision is not healing. So BI, incision not healing, whether that is your C-section incision or your laceration, just doesn't feel like it's healing well, or it's starting to display signs of infection. So it's like having weird colored discharge, it's warm to the touch, it's red to the touch. So next is redness. So this could be redness in your incision, your laceration, or redness in warmth in your legs, because again, deep vein thrombosis, risks of clots still is there postpartum. Next is temp. T for temp, greater than 100.4. We're always on the lookout for risks of infection. So redness around our incisions, temperature, as well as any funny like discharge colors, all reasons that are signs that there potentially is an infection and we need to assess and potentially see if we need to give you some antibiotics. And then last, H, headache. So again, postpartum preeclampsia can appear out of nowhere. You could have had no signs of blood pressure issues during your pregnancy and still develop in the postpartum. Headaches are a very common complaint in the postpartum period, but the biggest difference between a preeclampsia headache and just like a headache from like lack of sleep or potentially low iron is that no matter what you take, it doesn't go away. It's always slightly there. Even with low iron, I could take Tylenol and my headache would go away. It would come back once the Tylenol wore off, but it would go away. Whereas with a preeclampsia headache, if you took Tylenol, it's still there. It might be slightly less, but it's still there. Biggest difference between the two. But if you have a headache, just go in, be seen, get assessed to make sure your blood pressure is good and you don't have preeclampsia. Right upper quadrant pain, epigastric pain, blurry vision, all other things that we can look for before that elevated blood pressure. You don't need to go buy a blood pressure cuff and like take your blood pressure at home because these other signs are likely going to be there as well. So just to recap, birth is bleeding. If you're saturating a pad in 1 to 2 hours or having large clots, go in and be seen. Your incision or your laceration is not healing. You are having any redness or warmth within your legs or even your incision and laceration. Your temperature is greater than 100.4, like you're having those symptoms of an infection, and then any headaches that's not resolved with any sort of pain medication like Tylenol, any blurry vision, right upper quadrant pain of our abdomen, or even that center chest where your epigastric pain, where your liver kind of still extends. All of those types of pains, definitely reasons to reach out to your provider. And if, again, you can't contact them, seek help at the ER. Knowing when to seek help for yourself, it's sometimes hard during pregnancy and postpartum because you've got a lot of other stuff on your plate. And sometimes we prioritize everything else over ourselves. But during pregnancy and postpartum, knowing what to be on the lookout for in yourself as well as your loved ones, so having your loved ones watch this video can be helpful to be able to save lives. Because it doesn't seem like it would be a big deal, like, oh, if I don't seek help for like a headache or a little bit of bleeding, like I would be fine. You may be fine, but it also could be life-threatening. So please seek help if you have any of these things. You can call your provider if you are fearful that you're going to waste our time, but always come in. Don't feel like you're wasting our time. That's literally our job, is to help you. If you enjoyed this video and you want to learn more from us, please subscribe to our channel so you can be notified whenever we release new videos. We release 2 educational videos a week and 1 workout video a week. And if there's a topic that you're really wanting to learn more about during pregnancy or postpartum, please comment below and we'll be sure to create a video. And if you're pregnant or postpartum and looking to learn more from us, we have 2 different educational courses for you. We have our childbirth education, which breaks down the science of labor and birth to make it less mysterious and easier to cope with. We also cover labor comfort measures, labor positions, a bunch of different things to help you prepare for labor and birth. And then we also have a newborn and postpartum preparation course, which goes over what to expect in the first month postpartum and when to seek help and what is actually normal for both you and baby. And both of these are found on our website at MamasteFit.com along with our fitness courses. And you can bundle all of these things together to save an additional 15% off. And you can use code YouTube10 as a thank you for us to get 10% off any of our other offerings.